All right. And as you know, these days we're doing a live feature where we have one RCC who comes and tells us what the experience is like if you walk through their doors. And with us today is Tony Venzina from 4D Recovery. Tony, please take it away.
Sure. Yeah. And just thank you guys so much. Let me share my screen here and get my presentation going. My name's Tony Venzina, and I'm a person in long-term recovery. I'm really stoked to be here. I'm coming up on 9 years next month. I'm grateful. I'm honored. Appreciate all the work that the Recovery Research Institute is doing to push forward the science of recovery. I'm an advocate too, an organizer in Oregon, and I've had a trouble pushing recovery services forward over the last 7 years because we lacked scientific evidence to help underscore the importance and the efficacy of what we do, which everybody knows works on a practical level. It's been working for a long time. Primarily, I run the Fourth Dimension Recovery Center, 4D Recovery. It's a recovery community organization for young people. We focus on individuals 18 to 35. We have a variety of services. We have multiple recovery centers. Working on opening our third right now in a build out. It's been hard with materials and supply chain issues, but we're getting close, and then we're gonna be opening up a fourth one. We're located in Portland, Oregon. We do peer services. We're a peer-run organization. Everybody who works for us is in recovery, and primarily everybody on our board is. We have housing. We do recovery-supported housing. We do leadership development through civic engagement. So I run a leadership development program for young people in recovery, and we go out and do outreach at, harm reduction stuff, education, to policymakers and stuff like that, and try to help build up young people's efficacy through participating in advocacy and education. We do a lot of advocacy. I do a lot of advocacy work. I was at the Capitol yesterday because the alcohol industry killed all of our recovery bills. I had a bill in the legislature, House Bill 3111, that I wrote that would have created a recovery manager position in our health authority, and that person would have been responsible for overseeing the provision and contracting of recovery support services, including creating a network of recovery centers across the state. And it died, so that was my first time having a bill die. But people don't understand recovery centers and recovery services and the importance of them. And then we also develop best practices. What I wanted to kind of just go over today is that over the last year, we've been doing an evaluation with a third-party health consulting agency called CoImagine. And I just want to review kind of where we're at, some of the things that we learned. You can see here, I'm just going to glance over it, but this is for last year during COVID. And we're looking at clients served per month versus client encounters. And what you'll see is that we actually were able to increase the amount of clients, our peers were serving, and the volume in which we met with them. Part of that's due to telehealth and, digital communication. Part of that's due to us having to pivot and do even more outreach and engagement. We're an outreach and engagement based model. We go out and sell recovery. Now, the meetings, participation by month, that went down drastically. So, at one of our recovery centers, people were attending meetings about 5,500 times a month. When we hit the stay-at-home orders, those shut down. We shut down the meetings for 3 months. And then we've had trouble, with the meetings and getting participation ever since. Some people have went to digital recovery support, and that's been great. But a lot of people have wanted that in-person experience. And so we're working now on reigniting recovery across the state and getting people to go out and restart meetings and, do everything on the, on the natural recovery side, the organic recovery side. So this evaluation we did for a year, we wanted to collect data to support our advocacy efforts. That's one of the main reasons, so we could go out and educate lawmakers and stuff like that. And then additionally, we wanted to increase the effectiveness of service provision through our evaluation. The three key takeaways we had, and I'll make this report, available to everybody, is that we help people make progress on recovery outcomes and improve recovery capital. We complement traditional treatment for substance use disorder. One of the big issues we've faced is getting people to understand the difference between treatment and recovery support and how they complement each other, and developing policies, procedures, laws, and funding mechanisms that support a kind of a continuum of care, recovery-oriented system of care. And then, of course, investing in things like 4D and other recovery support saves money. Participants described 8 factors that facilitated engagement. I'm not going to read through all of these. I'll highlight a couple, but basically what we've been trying to explain to people is that, you know, recovery centers are about retention and engagement versus completion, right? So that's what we're trying to do. We're trying to retain people in recovery for the long term, you know, and our evaluation underscored that we were able to do that based on client testimony, you know. So, you know, we focus on fun, healthy recovery activities. We have a welcoming, non-judgmental space, staff who promote client-tailored goals, etc. There's about 8 things that clients stated that were really important to facilitating engagement, and that's what we want to do. And then, you know, we had participants agree or strongly agree that 4D recovery services help them make progress on recovery outcomes and improve recovery capital. Again, you know, these are individuals reporting these things that, you know, 92% of them said engaging in 4D improve their quality of life, help them achieve abstinence milestones, recovery goals, improved health, achieved employment goals, achieved education goals, etc., etc. So, you know, everybody knows that recovery centers work and all this stuff. We've just had a hard time getting investments in them, in the right type of investments, you know. And so I just wanted to share this stuff with you guys today. Lastly, I just wanted to, I don't have a lot of time, I just wanted to make you guys aware that, you know, I'm a part of a trade association for peer professionals here in Oregon. And, you know, primarily we do work on developing best practices for peer services. We have a ton of manuals that we've created. We have, you know, just peer supervision. If you guys need peer supervision best practices, we have those. We have kind of demographic specific best practices. I created a substance use disorder transition age youth best practice curriculum. We have one for older adults, etc., etc. It's on a website called MAPS. So I think that's my 5 minutes. I tried to breeze through it. I know it's a lot, you know. Key takeaways, you know, this report may be useful to you guys out there in advocating for investments into what you do. And that's all I hope that we can do, is help make recovery centers and recovery support services more available to people, because we know that they work, and I'm just grateful and honored to be here.
Great, thank you, Tony. And there's been a couple of questions on the kind of harm reduction strategies you use. The links that you have here, do you have information there? If not, we can pick this topic up again at the end, because I don't want to shortchange our other presenters too much. But is there a couple of things you want to say about harm reduction and where to find more information?
Sure. I'll put my email in there, and if you guys want to contact me, you can. You know, one thing that we do is we partner with local harm reduction advocates, you know, and then we distribute harm reduction supplies here in Oregon. You know, we decriminalized drugs this year, so there's, you know, a will to go to harm reduction, hand out like harm reduction supplies. We're still developing those best practices and building the plane as we're flying it. But I'll just put my email in the chat, and you guys feel free to reach out with anything that you might need ever, you know. And I'm just grateful to be here, and thank you to the Recovery Research Institute for all the hard work you're doing.
Awesome. Thank you, Tony. And building on what you had said about advocacy and needing science to back it up, for the scientists in the room, I would challenge you to think about what kind of science we can do to help create those talking points for folks to do advocacy. And for you guys who need science and facts, let us know which critical piece you don't currently have well documented, where we can help and generate some things that we should tackle going forward. And just put them in the chat, because we do log the chat and we do look at it and then form initiatives from there. So please continue on with that. All right, and now I will turn it over